Imagine struggling for each breath, your lungs working tirelessly, yet failing to provide the oxygen your body craves. This is the reality for millions around the world living with bronchiectasis, a chronic lung disease that often remains undiagnosed and misunderstood. One such story is that of Sarah, a vibrant young woman whose life took an unexpected turn when she developed a persistent cough that refused to subside. Sarah's story is not unique. Countless individuals battling this disease endure a similar journey of uncertainty, fear, and the daunting task of adapting to a life forever changed. Welcome to Physio Healthcare. I am Dr. Harry, a physiotherapist. If you're new here, don't forget to subscribe to our channel for daily healthy tips. To truly grasp the severity of bronchiectasis, we must first understand the intricate workings of our lungs, the very organs that sustain life itself. Bronchiectasis disrupts this delicate balance, transforming once smooth passageways into something resembling a block of Swiss cheese. The disease causes the walls of the bronchi to become inflamed, thickened, and scarred, leading to abnormal and irreversible widenings or dilations. This Swiss cheese effect has dire consequences for the respiratory system, hindering the lungs' ability to effectively clear mucus and fight off infections. One of the most common pathways to bronchiectasis begins with a familiar foe infection. While a healthy immune system usually fends off these attacks, sometimes these infections can slip past our defenses, triggering a cascade of events that can lead to lasting damage. The delicate lining of the airways, already weakened by the infection, becomes a battleground, scarred and thickened by the ongoing inflammation. This vicious cycle of infection, inflammation, and mucus buildup sets the stage for bronchiectasis to take hold. While infections are a major player in the development of bronchiectasis, they are not the only culprits. Sometimes the underlying cause lies in a more insidious faux immune system dysfunction. Autoimmune diseases, such as rheumatoid arthritis and Sjogren's syndrome, can trigger this misguided immune response, causing the body to attack its own healthy tissues. This autoimmune connection adds another layer of complexity to understanding and treating bronchiectasis. While lifestyle and environmental factors play a significant role in many diseases, sometimes the answer lies hidden within our very DNA. Certain genetic mutations, passed down through families, can disrupt the delicate balance within the lungs, increasing the risk of developing bronchiectasis. One such example is cystic fibrosis, a genetic disorder that affects the cells that produce mucus, sweat, and digestive juices. These genetic links underscore the importance of family history in understanding and managing bronchiectasis. The air we breathe, seemingly invisible yet vital to our very existence, can also harbor hidden dangers that contribute to the development of bronchiectasis. Air pollution, a growing concern in many parts of the world, is a major culprit. Tiny particles of dust, smoke, and exhaust fumes can penetrate deep into our lungs, triggering inflammation and damaging the delicate lining of the airways. Protecting our lungs from environmental hazards is crucial for maintaining respiratory health and reducing the risk of developing bronchiectasis. Imagine a scenario where foreign substances, instead of air, find their way into the delicate pathways of our lungs. Aspiration occurs when food, liquids, or even stomach acid accidentally enter the trachea and lungs, instead of traveling down the esophagus to the stomach. This intrusion of foreign matter triggers an immediate inflammatory response in the airways. Understanding and addressing these underlying conditions is crucial in preventing aspiration-related bronchiectasis. The airways, those intricate passageways that carry life-giving air to our lungs, can sometimes encounter roadblocks, literally. Obstructions within the bronchial tubes, whether caused by foreign objects, tumors, or even enlarged lymph nodes, can significantly increase the risk of developing bronchiectasis. This trapped mucus creates an ideal environment for bacteria to multiply, leading to recurrent infections and inflammation. Identifying and addressing the underlying cause of the obstruction is crucial in managing bronchiectasis. Our immune system, a complex network of cells and proteins, acts as our body's internal defense force, constantly patrolling for and neutralizing harmful invaders. However, Certain conditions can weaken this critical defense system, leaving us vulnerable to a myriad of infections, including those that can lead to bronchiectasis. These persistent infections, particularly in the airways, can trigger a chronic inflammatory response that damages the bronchial walls. For individuals with immune deficiencies, preventing infections is paramount in managing their risk of developing bronchiectasis. In medicine, the word idiopathic often signifies a frustrating reality, a disease without a known cause. Idiopathic bronchiectasis falls into this category, leaving both patients and doctors searching for answers in the face of uncertainty. While the exact mechanisms remain unclear, researchers believe that a combination of factors, including genetic predisposition, environmental exposures, and subtle immune dysregulation, may play a role in idiopathic bronchiectasis. This lack of a clear cause can make managing idiopathic bronchiectasis challenging. To truly understand the impact of bronchiectasis, we must step beyond the medical jargon and listen to the voices of those living with this chronic lung disease every day. Meet me, Sarah, a vibrant woman in my early 40s whose life has been profoundly impacted by bronchiectasis. My story is a testament to the daily struggles, the emotional toll, and the unwavering spirit of those navigating life with this often invisible illness. Sarah's story is not unique. Countless individuals battling bronchiectasis endure a similar journey of uncertainty, fear, and the daunting task of adapting to a life forever changed by a chronic illness. For me, and millions like me, life with bronchiectasis is a constant battle against a relentless cycle of symptoms that impact every aspect of our lives. The hallmark symptom, a persistent cough, is far from a minor annoyance. Adding to the burden, individuals with bronchiectasis are highly susceptible to lung infections. This constant cycle of infections and inflammation takes a toll on the body, leading to chronic fatigue, muscle weakness, and a diminished quality of life. Living with a chronic illness like bronchiectasis is not just physically challenging, it also takes a significant emotional toll. The constant battle against debilitating symptoms and the limitations imposed by the disease can weigh heavily on the minds and spirits of those affected. Bronchiectasis is often called an invisible illness because you may not look sick from the outside, but inside your body is waging a constant war. This lack of understanding from others can lead to feelings of isolation, frustration, and even guilt. Despite the challenges of living with bronchiectasis, I remain hopeful, drawing strength from my support system. My family and friends have been my rock. They provide unwavering love and understanding. Connecting with the wider bronchiectasis community has been life-changing. It reminds me that I'm not alone in this journey. In the next section, we will explore the latest advancements in bronchiectasis care. While the diagnosis of bronchiectasis can be daunting, it's crucial to remember that it's not a life sentence. Medical advancements and proactive management strategies help individuals live fuller, more active lives. The key lies in a multifaceted approach, addressing mucus clearance, infection control, and airway protection. Specialists work together to restore a patient's ability to breathe freely. This collaborative effort involves pulmonologists, respiratory therapists, physical therapists, and patients. The holistic approach aims to alleviate symptoms and improve quality of life. Imagine trying to breathe through straws clogged with thick syrup. This is the daily reality for many with bronchiectasis. Excessive mucus production creates a breeding ground for bacteria and hinders lung function. Airway clearance techniques, or ACTs, help patients breathe easier and reduce infection risk. These techniques use gravity, vibrations, or positive pressure to mobilize mucus. Chest physiotherapy involves postural drainage and percussion to dislodge mucus. High-frequency chest wall oscillation uses an inflatable vest to loosen mucus. The choice of ACT depends on individual needs and condition severity. Consistency with ACTs helps keep airways clear and reduce infection risk. Medications control inflammation, fight infection, and protect airways. Antibiotics treat acute exacerbations caused by bacterial infections. Inhaled corticosteroids reduce airway inflammation and swelling. Long-acting bronchodilators relax and open airways, easing breathing. Medications work best with airway clearance techniques and lifestyle changes. Lifestyle modifications are crucial in empowering patients to take control of their health and improve their quality of life. These changes focus on optimizing health, strengthening the immune system, and minimizing environmental triggers. Quitting smoking is essential for slowing disease progression and improving lung function. Maintaining a healthy weight through diet and exercise is crucial. Staying hydrated helps thin mucus, making it easier to cough up. Minimizing exposure to environmental triggers can reduce airway irritation and prevent exacerbations. Bronchiectasis, a disease that transforms the intricate pathways of our lungs into something resembling Swiss cheese, often lurks in the shadows. We've seen the daily struggles of those living with bronchiectasis, their relentless cough and the constant fear of infections. Yet despite its prevalence, bronchiectasis remains largely unknown to the general public. Imagine facing a debilitating illness without the support and understanding of those around you. Raising awareness is about fostering empathy, breaking down stigma, and empowering individuals. Awareness is the first step toward change, a beacon of hope for those affected by bronchiectasis. The journey with bronchiectasis, though challenging, is not without hope. Advances in research and treatment offer a brighter future. Improved techniques and medications enhance quality of life. Community and support are vital. Embrace hope, research, and community spirit. We've delved into the intricate world of bronchiectasis, exploring its causes, understanding its impact, and uncovering the hope that lies in research, treatment, and the power of community. But the conversation doesn't end here. Your voice, your experiences, and your willingness to engage are crucial in shaping the future of bronchiectasis care and support. Have you or a loved one been impacted by this chronic lung disease? Sharing your story can make a world of difference. Your journey, your challenges, and your triumphs can inspire others, raise awareness, and foster a sense of connection among those navigating similar paths. Leave a comment below, sharing your experiences, insights, and words of encouragement. Your voice has the power to educate, empower, and advocate for change. Let's break down the walls of silence surrounding bronchiectasis. Engage in the comments section below. Ask questions, share resources, and connect with others who understand the realities of this often invisible illness. Your voice is a powerful instrument for change, and together we can amplify the message of hope, resilience, and the pursuit of healthier lungs for all. The quest for knowledge and understanding is an ongoing journey, especially when it comes to complex medical conditions like bronchiectasis. Staying informed about the latest research, treatments, and support resources is crucial for both patients and their loved ones. Subscribe to our channel for more informative content on lung health, bronchiectasis management, and the latest advancements in research and care. Knowledge is power, and by staying informed, you empower yourself to make informed decisions about your health and advocate for the best possible care. Beyond subscribing, take an active role in your health journey. Don't hesitate to ask your doctor questions, seek out reputable sources of information, and connect with patient advocacy organizations dedicated to supporting individuals with bronchiectasis. The journey with bronchiectasis may be challenging, but it's a journey we don't have to face alone. Together, armed with knowledge, empowered by community, and driven by hope, we can navigate the complexities of this chronic illness and strive for a brighter, healthier future for all those affected by bronchiectasis.